So there's this tool which gives you insights about what questions you got wrong, and their difficulty index kind of value is also given, right? So you can know if you are making mistakes in easy, moderate, or hard questions. After solving enough questions, the app identifies your weak points, and it's really helpful to solve those questions again and revisit. I think it kind of layers your memory up one upon the other. So if you make a mistake first time, even second time, or even third time, the fourth time, definitely you will get it right. I think they have very old questions also. I think the question bank is really huge. So in exams like INICET, solving questions of old papers of NIMHANS and even old aims which used to happen, it gives you a great edge. Pre-PG also offers many clinical questions, right? And those questions are also what forms the basis of you as a doctor. Hello everyone, I'm Dr. Chirag Chakravarti, and I'm from 2019 batch. I've done my MBBS from Government Institute of Medical Sciences, that's in Uttar Pradesh, and I have secured the rank of 223 in this year's INICET May, and a rank of 361 in this year's NEET PG. So during my MBBS days, I was never really focused on preparing for the PG exams. I was just preparing for the professional exams and attended postings, and I just used to read a lot. I read many standard textbooks, and I used to like that a lot. So it was kind of difficult for me to transition into different, the notes that we have to read during the PG prep, because I was the standard books kind of guy, and I think many people will relate with me. But in April 2024, that's when my internship started. I was told to give a baseline GT. So I think I got around 137, 138 ish in that GT. So that's when my actual dedicated PG prep started. And one of my seniors had told me about this pre-PG app. So in the pre-PG app, there were regular tests which used to happen every day, like surgery, clinical focused, obs gynae, clinical focused, like that. So I started giving those, and slowly, consequently, it became a habit that I come back from my duties, and somehow I have to schedule or take out time to do that. Or even if I'm on the go or collecting reports or blood samples or anything, I used to solve a few questions in the app. So it was kind of a checklist thing for me that it had to be ticked every day, right? So my internship was, I think, just like any other medical college in India, it was hectic, kind of. Not kind of, it was hectic. So we used to go every day, come back at 5 or 6 maybe, and on call days, your whole day used to just, you were working all day in the hospital, and in the night also, and next day you were tired. So we used to just get some sleep, and I used to try to cover up whatever time was lost in the previous day. So it's really about having your mindset fixed on like doing something instead of achieving 100%. I think that's one of the biggest takeaway that I got while juggling my duties and studies. And thankfully, I had a really nice circle of friends, which were we always kept motivating each other. You get motivated by seeing someone going through so much, working whole day, and running here and there, and then coming afterwards to the hostel and studying. So that alone kind of gives you the motivation. Yeah, that why not? Why can't I do it? So I did my first reading in 6 months. Then I did my first revision in 3 months. than second. It was not a revision. I think my duties were very hectic at that time, so I had to redo the revision in order to, I think, feel satisfied or kind of gain confidence that yeah, I know something. So in that whole time, I was solving the tests which used to pop up in my notification on the pre-PG app. So what I liked the most was the prep DNA feature, right? So there's this tool which gives you insights about what questions you got wrong and their difficulty index kind of value is also given, right? So you can know if you are making mistakes in easy, moderate, or hard questions. I used to mostly do the, I think most of the hard questions I used to get right, but easier, moderate questions were the majority of my wrong ones. So I had to work on that. So that kind of insight is very useful. So after daily test, there was this revision feature which uh, collects and curates questions which you can do afterwards. After solving enough questions, the app identifies your weak points, and it's really helpful to solve those questions again and revisit. I think it kind of layers your memory up one upon the other. So if you make a mistake first time, even second time, or even third time, the fourth time, definitely you will get it right, right? So that's what we want, to get it right on the exam day, and it really helps to make that happen. And regarding INICET and NEET PG, I think we all know that INICET is very PYQ focused, and in the pre-PG app, I think they have very old questions also. I think the question bank is really huge. So in exams like INICET, solving questions of old papers of NIMHANS and even old aims which used to happen, it gives you a great edge, I think. And I think most of the enhanced questions were kind of one level above, and which would be counted in one of those hard questions in today's INICET, right? And for NEET PG, I think you have to hone your clinical skills, right? Practice as many clinical questions as you can, because now it's changing to a clinically oriented question stem, and then you have to make the diagnosis, and there's even questions 1 or 2 levels above that. So if your diagnosis is wrong, then I think it's really impossible to answer those questions, right? So pre-PG also offers many clinical questions, right? And those questions are also what forms the basis of you as a doctor, right? So and it's kind of fun also that you are able to diagnose any disease, and in the real life you see a patient, and with the exact, not exact, I mean I think 70-80% similar features, and you suggest to your senior resident or junior resident that this might be the diagnosis, and it really feels really doctor like kind of thing. So all in all, I think the basic takeaway that we can get from this is you have to solve daily questions, refer to prep DNA, and identify your weak areas. And regarding weak areas, I think there are different approaches. If you are a question bank kind of guy, then you can go with the brute force and solve as many questions as possible until you are good at it. And even some people like to read first. So in all, you have your weak areas and you know what to do with it, and that's what matters, right? And to those of you who feel average, I'm also very average. I never thought of myself as a brilliant or extraordinary student. And I some teachers or even some students used to say that toppers are a different breed and all, but I don't really think that's the case. I think all you need is discipline, complemented with a great mindset, and a clear direction, and believing in yourself that whatever you are doing is going to work out, right? And even if you have a simple approach, like reading main notes and solving questions, giving GTs every week, you know, and pre-PG app, it gives you notification every day, right, to solve questions and uh, revise accordingly, and referring to your weak areas by using prep DNA, and tackling those weaknesses by reading or doing questions until you are better at it. And this will happen in cycles. One topic will become weak, other will become stronger, and consequently you will climb up from 140s to 150s, 160s, 170s, even in 180s, right? And those scores are not really a surrogate indicator of how you're gonna perform in the main exam. I think it just gives you confidence, and your ability to rule out options and take those difficult guesses, and take a leap of faith on yourself, right? That whatever you're thinking is right, and learning to rule out options. I think that is what we have to master from this app, and that's only gonna happen if you stick to what the app offers you. It gives you regular notifications. Be sure to solve those questions, and give grand tests regularly. Identify weak areas, right, and keep going through it again and again. And slowly and steadily, I think you will do a lot better. You will be at a different level when you were around 6 7 months ago, and it's a gradual process, so you have to have faith on yourself and on the process, right? And even if your internship is hectic, you just have to do something every day, right? I used to solve I think around 100 or 150 questions daily. So even if you are on the go, shifting a patient, or in I think regular scut work that we do in internship, I think you can always take out time and do those questions, right? So yeah, so I think if I can do it, then anybody can do it. So it's just a matter of perspective. You don't have to be a topper all along to do well in these exams, right? You just have to do the hard work, and even if a topper doesn't do this hard work, then I don't think he or she will get any worthwhile rank. So yeah, I think that's it. All the best, everyone. Bye.